I'm Dr. Scott Fuller, and this is my show, Health Source. This particular show will be dedicated to if you are new to chiropractic, or if you've already had chiropractic care and you're looking for another chiropractic office, and maybe you're considering Fuller Chiropractic, my office, to see if it's a fit for you if you've moved here and you've already had chiropractic care and you're looking for a chiropractor. We're going to specifically address to you if you're a new patient and you're new to chiropractic care. This video is going to cover the following. We're going to talk about what to expect in the first couple of visits to my office and to other typical chiropractic offices. We're going to cover what it is to go through a chiropractic examination, orthopedic tests, and so forth. The second visit will be reporting back to you diagnoses and so forth. I'll get into that in a couple of minutes. And then what you should expect with ongoing care, and I'm going to talk about these chiropractic treatments that you hear about, these adjustments and so forth, and what to expect there. And a lot of the things that you've heard, I'm going to fortify some of the things you've heard and then take some misconceptions and deal with those for you as well. What to expect with follow-up visits. I'm going to also talk about the health and wellness culture in our office. As a chiropractor, I also consider myself a health and wellness expert. And I'm going to talk about what we tend to discuss with our patients on a day-to-day, visit-to-visit basis. It's much, much more than just chiropractic care, and it's much more than just caring for your spine. Caring for your spine is important. You only get one of them, so you really should take care of the one that you have. And when your spine gets really bad, that's no picnic to have to live and exist in that body with a terrible spine. So it's important to take care of your spine. We do address that very carefully in our office. But we also start talking about other aspects of health, including nutrition, exercise, stress management, supplements, and sleep. These are the types of things we talk about. And I have information resources available for you all over the place, online, papers in the office, and so forth. So we'll talk about that in the next few minutes. I'm also going to talk about what chiropractic is, how it works for you, and what these types of adjustments are and how they can help you with whatever health problem that you might be having and suffering with. Okay, so we're going to talk about these upcoming couple of visits as we move along. If this is the first time that you've received chiropractic care, congratulations. We certainly will work hard and hope that you get all of the results you're expecting, and maybe you'll get even a little bit more. If you've had chiropractic care in the past and you've had good luck and good fortune with chiropractic, and you're looking for another office, we will try to meet your expectations and the types of care and adjustments that you've had in the past. I've been in business here in Woburn for 19 years. I've been doing chiropractic for 23 years, and I happen to know a lot of the chiropractors in the area. So if you find that our office is not a fit for you, we can certainly make recommendations for you of other chiropractors in the area. And we have referral relationships with lots of doctors in general, and of course lots of chiropractors as well. So why do people come into our office for chiropractic care? Why do they consider chiropractic? There are of course the obvious ones. Neck pain, middle back pain, low back pain, arm and leg complaints. Those are the average things. But in our office, we tend to work on a lot of people for a variety of conditions. We work on athletes for peak performance. I see babies and children for wellness care. Children are oftentimes, and babies, brought in for trouble nursing, colic, allergies, ear infections, asthma. These things have shown, not in all cases, but shown to have very good outcomes with chiropractic care, and with the other things that I talked about too, the nutrition aspects and supplements and so forth. We treat pregnant women, the elderly, so we can pretty much take care of most people that come into the office. And the types of treatments that we have for these people will vary from case to case depending on the health and the size of the person, whether it's a 2-week-old baby or an elderly person in their 90s or pregnant women. We obviously make different types of treatments and adjustments in those cases. So, your first visit, here's what to expect. When you call our office, we'll set you up for a new patient appointment. The first visit usually takes 45 minutes to an hour. You can fill out our history forms on our website prior to coming in. That will allow you to take your time and remember some of the history things that are going on in your life, things in your past, even in your childhood. So we're going to cover your history in detail, and you're going to find at our office that we'd like to cover your health history in detail so we can really get a good understanding of where you are now, what you've been through, and that can explain why you might be having some health problems now in your life. So we're going to cover that in detail. That's why the first visit takes so long. Subsequent visits don't take quite that long. The examination. After taking your health history, I usually have a good idea of what's going on after taking a careful history. Then we'll move into examination. Examinations will include orthopedic checks, neurological checks. Of course, we do a spinal examination looking at posture and range of motion. We will do certain chiropractic checks as well, so that will be something above and beyond regular medical examinations. And we might take x-rays if necessary. I have x-ray facilities at my office, and we do spinal x-rays only if necessary. If you've already had some studies, if you're a child or an adult that has had x-rays, CT scans, MRIs, and so forth, we will take a look at those. We'll even look at your recent blood tests as well. That will give us another idea of where you are right now. After the history and examination, I will offer you a tentative diagnosis, and I'll explain to you what I think is going on, whether it's for you or if you're bringing in your child or an infant. I will explain, here's what I think is going on, and here's what I think chiropractic and the other things that we talk about in our office may help you. This is all done on the first visit, by the way. On that first visit, you might actually experience your first chiropractic treatment. We call chiropractic treatments adjustments. We're making adjustments to your spine to make corrections. An example would be if you bring your car to the mechanic, they might start the process of repairs. And if it's a front end alignment, they're going to start the process of realigning that front end. So we do the same thing in our office. We start to address the problems with your spine and your nervous system and go from there. After an adjustment, you'll begin to receive homework. And the homework that you receive are advice on making any changes to your lifestyle. So we might talk about making changes to the way that you're working. If you're sitting all day, and sitting is the new smoking, right? So we'll make adjustments to that. I will give you specific spine exercises. If you're a person that works out, maybe we need to make some temporary modifications to your workouts. We will do that as well. If you're somebody coming in with spinal pain, you will oftentimes receive icing instructions. Well, why do we recommend ice? Ice is anti-inflammatory, and if somebody's coming in with a typical neck pain or headache or migraine or back pain problem, whatever it might be, we always recommend ice. Why is that? Because anytime you have pain, you have inflammation. Whether it's a sprained ankle, a twisted knee, a sunburn, a bee sting, or a sprained neck, the body responds the same way with inflammation. Ice is anti-inflammatory. Heat is inflammatory. So we always recommend ice. Unless, of course, you have some contraindication to ice, whether you have a skin problem, circulation problems, and so forth. If you have any of those issues, then don't use ice. Most of you can use ice very successfully. So why do people recommend heat? Heat usually feels good for most people when you put it on. Therefore, you conclude you're doing something beneficial for your body. So people continue to use heat. And we get hundreds of phone calls, thousands of phone calls we receive from people. And they say, yeah, I've been baking my neck or baking my lower back with a heating pad, hot water bottle, and so forth, and gee, I'm not getting any better. My staff and I, we're trained to even give people advice over the phone on ice even before they come in for their new patient appointment. So my staff might even tell them how to ice, which is 20 minutes on an affected area, neck or back, 2 hours off, 20 minutes on, 2 hours off. We'll say don't put ice directly against your skin. Make sure there's a dry layer in between the ice pack and your skin, and keep doing that. And when people do that, they end up starting to get better right away, even before they come in for their appointment. I can't tell you, I've done this hundreds of times, switching people away from heat and into ice, and great things occur. Just remember, if I show you any spinal exercises, always do your exercises first and ice last. I'll get into that more so on my new patient appointment. You'll see information on my YouTube page and so forth on ice and not heat. Okay. So that's your first visit. Your first visit is the examination and history taking and diagnosis, and maybe you received your first chiropractic adjustment. On your second visit, again, this is at least how we do it in our office. We call the second visit a report of findings. So what I do is I report to you, after going over your examination results, your chiropractic examination results, and if you've had some x-rays, I'll go over the x-rays as well. I will review your diagnosis, and I'll say, I do think that this is causing your particular problems. Then I'll review with you your x-rays if you've had any, and answer any questions that you might have. And then we'll start to talk about a treatment program for you. Treatment plans and treatment programs are very similar to dentistry. So if you have a dental problem, let's say it's a fairly involved, serious problem, you're oftentimes going to be offered different programs to select. Maybe the first dental option that you have for your problem is a one-visit, low-cost, but a short-term solution to the problem. Maybe the next option will take a few visits, it will be more cost, and it will last a little bit longer. And then maybe the third solution for your dental problem might be something that will take multiple visits, cost a lot more, but give you a more permanent solution to your situation. A lot of people that come to us with spinal problems, a similar factor will occur. We'll give you maybe a shorter term solution to your problem, maybe something that will be more longer term. And whatever you decide to do is fine by us, whether it's a short term or a long term solution, that is fine. We will lay those out for you, and of course cost and number of visits and things like that. Right. If you don't have a case that we believe that will respond to chiropractic care, I will certainly let you know that. And if you're not a chiropractic case, I will make the proper referral. I refer back to medical physicians all the time. I also refer to physical therapy, other chiropractors, and so forth. Anybody that I think may help your particular situation. I now actually have medical physicians that are referring patients to me for chiropractic care. Now I'm out in Woburn, Massachusetts, a suburb of Boston. I have medical physicians that know me that are in Boston-based hospitals. They're referring patients to me in Woburn because patients are coming back to those doctors after chiropractic care at my office and saying, this worked fabulous, my particular problem is now solved and gone, thank you for referring me. The doctor remembers that. If they come across another case that's not responding to traditional medical care, they refer to my chiropractic office or other chiropractors as well. This is the way that healthcare should work, in my opinion, is we're all on the same team, whether it's a medical physician, a chiropractor, a physical therapist, an acupuncturist, or whatever. We should all work together and make proper referrals back and forth when something is not working. I do that, and I'm finding more and more medical physicians in my area are doing that as well. So it's a nice system, and we're all here for you. That's the way it should be. Follow-up visits at my chiropractic office. As I had said, the first visit will take the longest period of time. The second visit might be shorter, 15 or 20 minutes. Follow-up visits, depending on the involvement of your case, can be anywhere, for a couple of minutes to say 15 minutes. In our office, we also have as close to a no-wait policy as possible. Isn't that refreshing? When you have a scheduled appointment, we will either be able to take you right away or we're going to take you in a few minutes. Gone are the days when you're going to have to come into our office, wait a couple of hours to see the doctor for a few minutes, right? Been there before? So we try not to do that at all at our office. Okay. I remember when I was a child and I was going with my mother to the chiropractor's office. This is back in the 70s before chiropractic was popular. And the chiropractor was so busy that we would have to wait a long time in the waiting room before being seen. And my mother was having a lot of back pain and sciatica. And I remembered back then, I was like, boy, we really have to wait around here a long time. And when I got into chiropractic, I decided that I would never do that. So we schedule it very carefully. The next question that people ask us, of course, is how long is it going to take us to get well? And the answer is, well, it depends on your condition. It depends on your diagnosis. It depends on how involved these things are. Think of a sprained ankle. And I use this example a lot in my office and on my educational materials. A sprained ankle, when it's first sprained, we don't know sometimes how bad it's going to be. We're hobbling around for the first couple of days. It could be a mild sprain that might be gone in a week or two. It could be a moderate sprain that will take 4 to 6 weeks before you're back running around. It could be a severe sprain that might take months. Sometimes in the beginning we don't know. So what we'll do is we'll give you a range of time to get this problem solved. If I could accurately pinpoint down to the day exactly when you're going to get better, I'd be the richest person on the planet, right? We just can't do that. So we give you a range of time on what it's going to take to get better. One of the reasons I love working on babies and children and young adults so much is they tend to respond very quickly, with rare exceptions. Their bodies just haven't been through as much as we adults, right? So their conditions tend to heal up quickly. When you're an adult and you've had 20, 30, 40, 50 years of aggravation and trauma and building up of wear and tear in your body, oftentimes it takes longer for things to go away. Now, I know that we have this pill culture in our society here in the United States. We have a pill culture which is, if I have a problem, if I have a headache, I take a pill, the headache is gone, I'm good to go. Right? I want instant relief and satisfaction. And a lot of these cases that I'm describing, neck and back problems and so forth, they may take some time to heal up. Take a serious disc problem in the neck or back. If any of you are watching the show and you've had that type of problem, if you haven't, you know people that have been through this, of course. That can take a long time to solve conservatively, let's say without surgery. And let's say that you have a surgical problem. The recovery after surgery also might take some time too. So the most important thing I can tell you when you get started, whether it's at my office for chiropractic care or whether it's physical therapy, whatever you might be engaging in, medical care and so forth, you have to know that this is a process. It's going to take some time. That sprained ankle, we want it to be better tomorrow, but it's just not going to happen tomorrow. It's going to take some time. We can't cheat nature and expect it to heal tomorrow. It's a very difficult case when somebody comes into me as a new patient, first time under chiropractic care, and they say, I am crippled, I couldn't get out of bed this morning with my terrible back pain, and I'm going on vacation tomorrow, right? Can you fix me up today? Oftentimes that cannot happen. But I've had cases where somebody comes in crippled and they're saying, I'm going on vacation in 3 or 4 weeks from now. What do you think? And I say, well, let's get you as good as you can be before you go. And oftentimes, again, we're successful with that. A quality about our office that all of you should need to know, whether you're new to chiropractic or if you're someone who's considering another chiropractor, we don't push you. What I'm getting at is, you may have been in other doctors' offices where the staff or the doctor are pushing you into receiving more care than you're comfortable with. And I just want you to know that we don't do that here. We never want you to feel like you're being pushed or asked to receive more care than you feel as though you really need. And that's a refreshing way to go through this. Whatever you decide to do in our office is fine by us. If you ever feel as though you want a second opinion with the care that you're receiving in our office, we will be happy to help you get a second opinion. You can take your x-rays, a copy of your records, and go to another doctor's office for a second opinion. Now keep in mind, this is important. If you're going to get a second opinion on chiropractic care, do it with another chiropractor. Don't go to a medical physician and ask them to comment on chiropractic care. That would be like asking your medical physician to comment on your dental work. It doesn't work that way. If you have a dental issue and you want a second opinion, you go to another dentist. So if you have a chiropractic issue and you're looking for a second opinion, go to another chiropractor. That's going to serve your health in the best way. If you could get better in one visit, I would do it. And as you can imagine, the line to see me would be out the door and down the street, and I would charge $10,000 a visit. It's not going to happen. Again, we can't cheat nature. But we will work with you. My staff and I will work with you in the best way possible so you can get the quickest healing and the best quality healing with whatever problem that you might have. And we'll come into it with different angles. We're going to do the chiropractic stuff. I'm going to give you ergonomic information, specific spinal exercises, advice in changing your work and hobbies and sports. We'll get into the nutrition and the supplements and the sleep and the stress management. And if we do all of these things to help whatever problem you're coming in with, we'll have the best result. If somebody's had migraine headaches for 30 years, which I've had patients with, it might take some time for that to get better, but oftentimes they do. And I'm thinking of one woman right now that had migraines for 30 plus years. It took us 6 months or more before she felt really well. But boy, was that worth it. Now she has oftentimes no migraines in the course of a year. If someone has chronic neck pain for 10 years which hasn't responded, it might take some time for that to get better. But if people are patient and they understand it's a process, it's worth that time and effort. After care is over, after your pain relief has been achieved and so forth, at my office I also have maintenance and wellness options. Some people choose that, some don't. Whatever you choose is fine by us. But we like to model our chiropractic care after, let's say, dental care. After you get a clean bill of health at the dental office, let's say you go in, you have a cleaning, everything looks fine. You know that you're going to stay diligent with your homework. You're going to brush 3 times a day, you're going to floss once a day, you're going to try to avoid snacks in between meals, and you're going to continue with that specific teeth exercises and maintenance for 6 months until your next checkup. I would imagine you're probably not going to say, hooray, I just had a dental checkup and everything is fine. I'm going to stop all of my maintenance care with dentistry. I'm not going to go for the cleaning for a couple of years and I'm going to stop brushing. Well, you wouldn't do that. You've already been educated that that's the wrong thing to do. We offer similar maintenance and wellness plans in our office where you can come in on an infrequent basis after your pain is gone to keep you in shape and try to reduce and possibly prevent the problems from ever returning, if you decide to do that. Obviously, step 1 is to get you feeling well and get you healthy first. We have other information available. We have information via classes, online, papers in the office, and so forth. The first additional piece of information that we have is called a health and wellness class. We invite anyone who wants to come to our health and wellness class to come. You do not need to be a patient. This is a free class. It's always been free. I've been doing it for 23 years, ever since I've been a chiropractor. And I do it once or twice a month at my office. It's 45 minutes to an hour long. And I start at that class to teach you how to prevent spinal problems from occurring, do's and don'ts of home care, exercises we recommend to do and to avoid, modifications of workouts. And at that health and wellness class, we begin to introduce the other wellness lifestyle that we recommend. We start talking nutrition, stress management, supplements, sleep, and so forth. Health and wellness class. You're going to see that class available online in the future. You're going to watch my other YouTube videos, which has pieces of that health and wellness class for free. Start educating yourself. Plug yourself into this health and wellness class. If you want to come to it, call our office. Some patients will come to the health and wellness class before they even sign up to become a new patient, just to kind of kick the tires a little bit and see if this office and myself, Dr. Fuller, to see if I'm a good fit for them. So consider that health and wellness class. We also offer other workshops on nutrition and exercise. And I have a book called Happy Back. Another book is on the way. I have CDs, DVDs, and online videos. So you can begin to plug yourself into these other networks of information if you so desire. I like to ask people this question, well, what is important to you in your life? What is it that you want to get back to do? Some people want to get back and do their hobbies, whether it's playing golf or riding a bike or something like that. Some people are struggling to get through their workday. Others, older people, want to say, I want to play with my grandkids and have that health and flexibility to do so. Well, our job is to get you back to a better level of function so you can enjoy those things that you want to do. That's why I believe I'm a chiropractor. And that's why a lot of people find that when they introduce chiropractic into their life, they're able to do the things in their life that is important to them, whether it is work, hobbies, playtime, sports, playing with their grandkids, whatever it is. Or maybe the parents that are up for hours a night for months and months with a colicky baby, maybe they're just bringing the colicky baby in to get the baby better, but so they can get their sanity back as well. So there are many different reasons why you need to think about the important reasons to come in and see us. So how to pay for chiropractic care? Most insurances have at least some chiropractic benefit, and we are in network and we accept almost all insurances now. There's a few things you need to know. Most insurances are now limiting benefit, just like they're limiting benefits with everything else. Gone are the days where you can go to a chiropractor forever or physical therapy forever or whatever and have it paid for $5 a visit and so forth. Most plans have a number of visits per year that they'll pay for. Say 12 visits a year is very common. And then after that, you'll be a cash patient. A lot of our patients transition to cash. And our cash fees are in such a way that As co-payments and deductibles continue to rise, unfortunately, our cost per visit is oftentimes as much as or even less than a typical insurance co-payment. We're finding $75 and $100 co-payments that people have with their insurances. Well, our visit fee is less than that, so oftentimes people just pay cash. And that's just the way of things. That's the trend of things going up and up. Something else important about insurance that you need to know. Medical insurance only pays when you are in acute musculoskeletal pain. They do not pay for chiropractic wellness and maintenance visits. They do not pay for infants with colic and asthma and allergies. They don't pay for kids with ADD and ADHD and other learning and behavior issues, which are other reasons children are brought to us. Unfortunately, insurance doesn't pay for any of those things. So just keep in mind you're going to be paying cash. If you're wondering what those fees are for new patients' evaluations for infants or children or for yourself, if you have, let's say, a large deductible, just call our office. We will go through that even before you set up a visit. So just let us know. That is an important thing about insurance. Not one insurance company out there pays for wellness and prevention. And it's also sad that even if we keep you at a certain level of health, let's say you have chronic pain and you come into our office and we're able to decrease that somewhat and hold it at a particular level, they won't even pay for that ongoing supportive care. They actually call it supportive care, and that is not a chiropractic benefit. They only pay for something acute, and when it's gone, there we go. This is important. I want to let you know that in our office, we care for people. We care for patients. We do not make care plans based on what insurance pays or will pay for or does not pay for. It's different than medical care, which can be very, very expensive. The chiropractic care, in comparison, is very inexpensive. We treat you, we focus on you and your children, we focus on our patients. We just deal with the insurance thing on the side. That is a secondary issue. And if you have any financial issues or considerations that we need to know, talk to us. We'd be happy to work out a plan that is affordable to you. Our favorite time in our office is to convert somebody with health issues and health problems and move them over into a wellness care scenario. And the beauty of wellness care is just like dental care. If your teeth are in great shape, you have to go to the dentist a couple times a year. That's very inexpensive than serious dental problems. The same thing with chiropractic care. Once we get you cleared up and you're healthy, we need to see you a lot less for a lot less cost every once in a while just to tune you up, as we call it. We call it a tune-up chiropractic adjustment. The reasons that people come in for chiropractic care are endless. Headaches and migraines, concentration and memory issues, gastrointestinal problems and menstrual problems, fatigue, inability to lose weight, respiratory skin and sinus problems, extremity joint pain, fibromyalgia, autoimmune issues such as rheumatoid Crohn's and colitis, multiple sclerosis, Hashimoto's hypothyroidism, and I mentioned that children come in with colic and ear infections and asthma and difficulty nursing and so on and so forth. Does chiropractic work in all of these cases? No, of course not. But adding chiropractic, people have noticed wonderful things occur. Go to my website and look at the passionate testimonials that people have written about results. Well, thank you for listening. And if you have any questions, you're welcome to email us, call our office. We'll answer the questions. If you want to come and see our health and wellness class, you're welcome to do that as well. And we hope that you enjoy your chiropractic experience. Thank you.